Cholera in Haiti, the consequences of a broken health system. Today I will be speaking about the 2010 cholera outbreak in Haiti. I will examine the Haitian healthcare system's response to the outbreak as well as the global response. I will also examine the role the United Nations played in the outbreak and the role international organizations played in containing the outbreak. Purpose and objective. The purpose of this presentation is to examine how global governance mechanisms can work to contain an outbreak while strengthening a weakened healthcare system. We will explore how the outbreak began and the response from the Haitian Health Ministry. We will also examine the role of international organizations in containing the outbreak. Finally, we will look at where Haiti is today and the lessons learned from this experience. This table of content represents a quick overview of what I will be covering in this presentation. We will begin by looking at an overview of the Haitian healthcare infrastructure before the outbreak, followed by an overview of the history of natural disasters. We will look at the origins of the outbreak, the coordination of the response, and the collaboration between the Haitian government, global organizations, and local entities. We will conclude by looking at how cholera was eradicated and the current healthcare system, examining both its challenges and victories. Haiti's healthcare before the outbreak. Haiti is the poorest country in the Western Hemisphere, ranking 68th on the United Nations Development Program Human Poverty Index scale. Haiti has been plagued by political violence for most of its history. Corruption and political instability have led to the collapse of infrastructure as well as natural disasters. In 2008, Haiti experienced a severe hurricane followed by a massive earthquake in 2010. Before the 2010 earthquake, the Haitian healthcare system was already in distress. In 1999, the leading cause of death for children was diarrhea. Public health care expenditure represented only 0.8% of the GDP, and in the year 2000, infant mortality rate was 80.3. In 2006, the incidence of tuberculosis was 133 per 100 person, and health services reach only 60% of the population. Haiti is the second most affected region in the world for HIV infections, and half of the population did not have access to medications. Natural disasters. Throughout its history, Haiti has experienced several natural disasters. May 23rd and 24th of 2004, Haiti experienced torrential rains that caused extensive flooding. Entire villages were washed away. The death toll was estimated at over 2,000. In September of 2004, two hurricanes, Ivan and Jeannie, caused extensive damage, killing 3,000 people and displacing over 300,000. From August through September of 2008, Haiti suffered multiple tropical storms and hurricanes. 800 people died and $8 billion of property damage was done. In 2010, Haiti experienced its worst earthquake, killing approximately 300,000 people. Essential services and vital infrastructures were completely destroyed. Hospital and aid stations collapsed. The origins of the outbreak. In 2010, cholera was introduced into Haiti's longest river through improper disposal of untreated sewage from a UN peacekeeping base in Central Plateau. The outbreak was linked to UN peacekeepers from Nepal who were assisting with emergency work after the earthquake. As per reports, the water became contaminated with fecal matter. The bacterial strain Vibrio cholera, when ingested, caused severe diarrhea and vomiting, leading to dehydration. Without proper treatment, including oral hydration, it would be fatal. The Artibonite River is one of the main sources of water in Haiti. Each year, tens of thousands of Haitians bathe, wash their clothes, dishes, and drink from there. The outbreak was associated with severe diarrhea and affected over 820,000 people, killing over 9,000 people. This number is considered to be an underestimate due to improper and incomplete reporting. Initially, the UN denied its involvement, but after several scientific investigations, in 2016, the UN admitted to bringing cholera to Haiti. During the 6 years before its admission, riot and demonstrations were held by the Haitian people demanding answers. People marched on the streets, blocked roads, bridges, and airports, preventing the movement of humanitarian aid. Protesters were met with tear gas, and some people were shot by UN peacekeepers. Distrust for the medical workers and the UN hindered treatment, including the construction of treatment centers and the delivery of supply. During its admission, the UN pledged $400 million to treat cholera victims and improve the sanitation and water infrastructure. Today, many of the victims and their families continue to bring legislation against the UN for compensation. According to a 2020 report from the Human Rights Harbor Law Group, the UN has refused to provide funding through its regular budget and instead has relied on charitable donations, which have only raised 5% of the $400 million promised. Outbreak coordination and response. Coalition building happened quickly as the Center for Disease Control and the UN were already stationed in Haiti, assisting with the hurricane. The efforts to eradicate cholera were made up of multiple partners, including the CDC, Action Against Hunger, UNICEF, who instituted a WASH program, the World Health Organization, which worked on creating a vaccine through its partner organization, Pan American Health Organization, PAHO. The CDC leveraged its resources through the President's Emergency Plan for AIDS Relief, PEPFAR, to increase the number of cholera treatment centers and oral rehydration points. With the help of PEPFAR and the CDC, about 10,000 community care workers were trained to work with the population. Non-state actors and community actors also played a major role. The Haitian Ministry of Health Labo Moto Project dispatched field nurses to collect samples and quickly transport them to laboratories on motorcycles. A non-for-profit organization called Partners in Health and its sister organization, Zani La Sante, trained staff and assisted with coordinating the response. The first few months of the outbreak, doctors from Doctors Without Borders and the Cuban Henry Reed Brigade, both self-financed, handle most of the cases. During this time, doctors complained of having to walk on feces, unsafe working conditions, lack of personal protective equipment, and understaffed hospitals. Many people died and mistrust of doctors began to arise. The response faced several barriers with regards to policymaking and the inability of the actors to come to an agreement on how to spend the collected aid. Allegations of corruption against several organizations were reported. The American Red Cross was found to have $479 million unused. They ultimately used $18 million on prevention and treatment. There was also concern about the cost of immunizations. Citing cost and limited supplies, the World Health officials initially did not endorse the use of immunizations. Organizations argued that immunizations would provide a false sense of security. Finally, in mid-December of 2010, the Pan American Health Organization agreed to a pilot vaccination program. The eradication of cholera. As of January 24, 2020, Haiti has celebrated 1 year without any new cases. Although the response faced many barriers, medical sites were created and medical staff were brought in to assist in the containment. Through the Haitian Ministry of Health, collaboration with global partners such as PAO, the CDC, and local organizations, a surveillance program was implemented. Thousands of community workers were hired and trained. Through the use of surveillance, cases were quickly identified and isolated. Rapid diagnosis and testing were conducted and treatments initiated. Hygiene stations and education was provided, as well as the implementation of a vaccination program. To date, over 900,000 people have been vaccinated. Summary. Today, the people of Haiti remain vulnerable to dislocation by natural disaster, severe inequality, and poverty. In the last 10 years, the country has dealt with two massive natural disasters, geographical and financial barriers to accessing health services, shortage of essential medicines, and difficulty attracting and retaining qualified health professionals are all chronic struggles for Haiti. It is estimated that more than 55,000 Haitian children under 5 will suffer from malnutrition in 2020. Today, 1 in 3 Haitians is in need of food assistance, and 1 million are living in severe hunger. The UN continues to evade monetary responsibility and has done little to prevent similar health disasters. Nonetheless, the cholera outbreak has been contained, and as of January, Haiti has celebrated 1 year without any new cases. The country has seen some improvement in their healthcare delivery, with 54% of Haitians now having access to healthcare, 62 to improve water sources, 26 to non-share sanitation facility, and 24% to hand washing station. The current COVID-19 presents additional challenges for a country newly celebrating the eradication of an outbreak. It remains to be seen if the lessons learned from cholera will be applied.